Medical Testing in Practice, Part 2, brought to you by Testing Wisely. Let's return to the 3 Ps framework. Tests help clinicians identify disease and treatments to improve patient outcomes, but there are pros and cons to consider. Let's walk through a second clinical case. A doctor is concerned a patient, Mrs. Patel, may have a pulmonary embolism, or PE. Mrs. Patel is a 55-year-old woman with shortness of breath. Mrs. Patel is a non-smoker. She recently underwent surgery and was bedridden for a week. This increases the pretest probability. On physical exam, she's breathing fast, but says she's not experiencing chest pain or wheezing. There are 2 tests for a pulmonary embolism, CT scan and D-dimer. They're fairly different, so let's consider both tests for Mrs. Patel. A CT scan has a sensitivity of 90% and a specificity of 92%. A negative result means there is a 0.3% chance the patient has a pulmonary embolism, thus the doctor rules out PE. A positive result is more difficult. A positive result means the probability of disease goes from 3% to 26%, which is generally below the treatment threshold for blood thinners, yet most doctors would treat all positive CT scans. Consider the pros and cons of testing. Pros: CT scan detects about 90% of PE. Negative results exclude PE. Cons: 6% renal injury, 18% incidental findings requiring follow-up. 3 to 10% false positive PE requiring medication with a major risk of bleeding. The doctor orders a D-dimer test. Remember, the patient has a pretest probability of 3%. A D-dimer test has a sensitivity of 97% and a specificity of 40%. A negative result indicates a 0.23% chance the patient has a pulmonary embolism, thus the doctor rules out PE. The test is 97% sensitive, and a positive result means probability goes from a 3% to 4.8% chance. A positive D-dimer is usually followed up with a CT scan. After a positive D-dimer and positive CT scan, probability goes from 4.8% to 36%. This is closer to an appropriate treatment threshold for PE. Sequential testing often improves testing characteristics. Sequential testing is often better than a single test. A quick D-dimer test can rule out PE in many patients. Tests like CT scans have pros and cons. The pearls to remember from these practical examples of medical testing include: there are pros and cons for every test. Sequential tests improve performance. Tests like D-dimer are most useful if negative, to rule out disease. Visit www.testingwisely.com.